Honorable guests, ladies and gentlemen, after having a short coffee break and the presentation and discussion session before that, our next agenda is to have comments from Professor Rainier Sobern about the presentation and discussion. And to lead this session, I would like to invite Dr. Yodi Mahendra Datta to be the moderator and Dr. Randi as the secretary. To Dr. Yodi, you may have the floor, please. Thank you.
Okay, thank you very much, dear colleagues. We will start with the commentary sessions, which will be delivered by Professor Rainer Sauerborn. Professor Sauerborn will comment on both the consortium aspect, which was discussed by Group C, but also touched on the content side, which was discussed by Group A and B. Professor Sauerborn, the time is yours for the comment. Please,
Good morning. And thank you very much for giving me the chance to comment on what I consider two very productive days. I was particularly impressed by yesterday's small group meetings and what they could achieve in so little time. So a word of congratulations is in order to start with. Now here are my comments. I think this consortium is called Global Health, and I congratulate you on this focus, and I encourage you to keep and strengthen this focus. And the problem is now, not the problem, the challenge is how to bring these two clusters together. You have one new area, which is climate change. This, to start something new, is quite a different task compared to strengthen something already existing. The NCDs, as I'm very impressed, is very well established from the biomedical side and to a certain extent also from the public health side. Now you want to put a global angle at something that already exists. Climate change, you want to set up something completely new. And so you need to create new capacity in both, but particularly in the first one. And I will come back to how this is done. I think doctoral students is not an exclusive ways. Doctoral students and professors, there's some crucial link missing. Yesterday with Professor Yati, we discussed that this is a ladder which has the middle rung missing. So you have the students who need a lot of hand-holding, and you have the seniors who are overly busy and will be absorbed completely by supervising the students. So you need, in my way, a middle rung, which I'm told by you, Yodi, that it doesn't exist to have postdocs, to have junior groups, as they have it in the US, and we copied it from there, which is to give a young person like Yodi a group, responsibilities, independence, a budget, and some criteria according to which he or she will be evaluated after 3 years. A 5-year group, by then you should have published 29 papers, and you should have taught, 30. You should have taught so and so many, and you should have supervised, and you get a budget which allows you to recruit a research assistant, 2 doctoral students, and some seed money to do research. That has proved, first in the biomedical, but then also in the public health sciences, to be a very good way of building new capacity. Because the senior ones are overly busy, the junior ones are not yet there to write proposals. This is the, if you allow me, the middle class. It's not. It's the middle. It's the. It's the ones that are in full strength, that are committed, that write proposals, that publish, and I think you need to put these rungs in the ladder. I don't know how this can be done. I mean, it seems that the structures are not there, but you should also make a point. This consortium will break new ground also in the way to do business, not only in the topics. Yeah. So that was this comment. And how can these clusters be coherent? A classic evaluator's comments to this would be, all very nice, but it won't fit. It's nice to do NCDs, it's nice to do climate change, but why is this one consortium? I mean, these are 2 brothers or sisters that don't have any relation with each other. So I think it is very useful to show that in the proposal in a very proactive way and have a chapter on coherence. And here are some suggestions. Both groups, and also yesterday in the morning, we talked about joint MSc, joint master in the joint PhD program. I know that you don't have, and we in Germany neither. We are just setting one taught doctoral program up. We should maybe consider to set up a joint master and PhD in global health with a track in NCD, with a track in climate change, and then you can be open later, a track in mental health, a track in, you name it, injury prevention, you name it. So I think that would be good. Then we have something in common, the NCDs and the climate change. Otherwise, these are parallel operations that, why should they talk to each other? NCD and climate change, such a different thing, you know. But here you have a common platform where both are teaching and both are contributing their angles to the concept as Jodi so nicely presented it. The joint journal is a very good idea. I congratulate you on this. I would definitely propose that already in the proposal. But a joint pre-publication series is even, not, I would say better, but is a step before, which allows junior researchers and even doctoral students to publish something that is not brutally reviewed by international reviewers, but which is reviewed by a panel, an internal panel, and which is for discussion among, again, the entire center, and presentation. The juniors have a chance to publish something. They can put it in their CV. Global Center publications, the Global Center discussion paper series, something like this, 1, 2, 3, 4, 5, and that is also something that would bring you together. So the journal, the pre-publication series, and then these two, or one or two, or whatever number you choose, study sites. I think this is crucial. Where it is and whether it's one or two, I would think this is up to you to debate. It costs roughly $250,000 per year to maintain such a site. So it is within the reach of this very lavishly funded program, and even two could be done. The main thing is that you use it for both. And I was a little bit worried when I heard we'll have an NCD area, sort of a playground, and we do a playground for climate change. That would defeat the purpose and be a waste of money. And it would forego the chance to tell the funding, the donor, we are working together on the problems of populations. And here we have these populations. We have one urban one and one rural one. We have a slum, whatever you choose. We have a rural, we have a coastal, whatever you need in terms of diversity of these populations. That could be something, a very strong argument that you're indeed working together. And I must share with you an experience that I had. I once triggered or proposed with 20 colleagues from molecular biology to anthropology. A similar grant, which was called Control of Tropical Infectious Diseases, where we said we need the lab sciences, we need the public health, and then the reviewer said, it's very nice, but I don't believe that you work together. Everybody's just trying to get money, milk this cow, and go away with the milk and do their cooking, you know. That was the words they used. So we had a tough time responding to this. And one of the most convincing arguments was, we will work together on one population and their problems. And it is the population that we use as a lens for all our scientific, we want to solve their problems and alleviate their cancer burden, their risk factor burden, their climate health, the climate vulnerability, and so forth. So I think that would be a very strong argument, and it would also be very good for the research if we had a long-term population surveillance, because both, one common feature of NCDs and climate impact is that it takes time to develop. And this is why cross-sectional surveys, or some hit-and-run research, as I call it, you go in, ask and go out, or collect specimen and go out, won't cut it. And this is why we can argue very well, we need a population that we are accompanying across 10, even more years, because we will see how a risk factor develops into a disease, how a disease stage 1 develops into a disease stage 2, unless we do something about it. How climate change, which, as you've heard, unfolds over decades, how climate change is acting slowly on these populations. So I think that's a very good idea, and I would strengthen this very much, that the two topics have in common the long-term time perspective under which the bad influences, the risk factors here and the climate exposure there, unfolds. And somebody said yesterday life cycle analysis. Was it you?
Life cycle stage.
Yeah, so we have the chance also to look at from children, even before they're born. You know that low-weight babies have a higher chance to get hypertension later. So we need this. We cannot do our research agenda with cross-sectional research. So, and then you have already had the idea of joint stewardship. That is, you had very good ideas on how to do this. And I just want to suggest that we also think about stewardship of the bridge between Germany and Indonesia, that we have some ideas. Is there a committee, steering committee that manages the entire 2 pillars, or how do we do this? One thing that I didn't put in the slide here because I didn't have too much time was technology. We didn't talk a lot about technology. I mean now communication and technology. How do we work? Can you deliver a lecture to my students, and can I deliver a lecture? Can I supervise my students by teleconference? And I was told that the capacity is here, so we should state this. And you know, in the dead swap, there's even one of the 8 or 9 centers, there's one that is called IT. And I think we should allude to this and say, we partially have and will use the funds to develop state-of-the-art information and communication technology. We will have a joint server where we exchange documents. All these buttons we will have to push, that we are aware that even if it was not without Germany, even among you, you would have to have this, because you're 500 kilometers away, and you can't just do it by physical presence all the time. Under coherence, maybe it's good if you say there's also coherence between disciplines. How does a social scientist and a geographer, can they supervise the same student? And global health, by definition, as we've heard yesterday, is interdisciplinary. It can't be done by one discipline alone. And so sometimes it would be a good idea to say, in respect or acknowledging this interdisciplinary character, we want to have supervisory committees. I don't know exactly how you work with doctoral, I'm talking about doctoral candidates now, that you have, if possible, 2 disciplines. Let's say a molecular biologist and a population epidemiologist. And they work on population genetic risk factors for this and this and this cancer type, or this and this and this CVD type. So that would be maybe something to think about, whether you want, how you link the disciplines. Before I just thought how you link the 2 clusters, now how you link the disciplines. And while I'm at disciplines, I think in the overall, I think there's some noise. In the overall proposal, the social sciences are dearly missing. If you make a proposal for global health, I think we should talk about political science, economics, sociology, anthropology, cultural sciences, and I don't see in the proposal how they are really tapped. I know they exist, but maybe since this is a kind of medical faculty led endeavor, maybe they were a little bit underrepresented. So what the climate change group proposed is an inventory of needed disciplines. Who has gurus and who has scientists in economics? And that you make a roster or a matrix which says these are the disciplines that we need, from molecular to anthropology. And this university has a great person in cultural studies, and here is a great person in this, and then you show this matrix even in the proposal and say, look, together we are stronger than each member can do it alone. And you also acknowledge that you understand, and not only understand but implement the idea of disciplinarity. Can you continue? You remember we talked about this yesterday. There needs to be objectives, and not only we want to change the world, of course, or we want to do science and produce papers, but also procedural things. We want to establish 5 junior groups in 2015, and we want to evaluate these junior groups after 3 years. We want to establish the master course here and there. We want to recruit so many PhDs and recruit the professors. This needs to be so quantitatively defined and time specific that people can evaluate you on this. And this will be evaluated, I'm sure. Both your government and my government will set up maybe a joint committee, or maybe different, I don't know, system of evaluation. Administrative evaluation, did you spend the money well, did you overspend, and so forth, and also substance evaluation, did you do what you proposed to do. And in order to do this, I think we need to give them the criteria according to which we want to be evaluated, rather than leaving it to their whim to do it. So what is important for you should be in your objectives, and then you should even propose an evaluation scheme. We want to be, this is a 10-year program, I think we should have a mid-term evaluation after 5 years, or an evaluation of the setup phase for the infrastructure after 2 years, and then at 8 years we want to have, or 9 years, we want to have a final evaluation, and the final evaluation should then talk about sustainability and how to continue. So that is something that I think would be a good idea. Yeah, to establish the junior groups model, I mentioned that already. I don't see how you can do it otherwise. This vast build-up of the intellectual firepower to do the work. And as we said, the core funds and the competitively acquired funds, if I may use this graph there, I had an idea how to maybe put it in a graphical form. You can have the timeline. And there should be a core. All the way through, and then you say yourself, there should be not only memorandum of understanding among the partners, but also with your government or with your universities to say this amount of money, we, the vice or the rectors of these universities, commit to continue this whole funding pending on an evaluation. So they are not committing to anything. They can expire if this effort says you did the job. And then we will with all the stamps, with all the stamps on it that, you know, rector here, rector there, that is very good. And it should be in clear language, leaving no wiggling room for lawyers to step down. So if it's evaluated positively, we commit, and that can be 1/10 or 1/100th of the sum, but you should define what it is. Secretary, office, these professorships we will take over Well, the junior groups, they should fund themselves by then. So it's be careful thinking what it is and that each university contributes. Then you have this huge amount of money. This is now the funding from the debt swap. So that's here. And you should have a kind of decreasing, it's over. So whether the last person turns off the lights or whether it continues is a matter of the blue. After, you should say, by then, when the junior groups are running, the first doctoral students are coming back. Doctoral students should publish 3 papers. So we will have 59 papers, we will have 5 junior groups at full speed. So from here, money will come in, competitively acquired. Competitive funding. We should also have a concept on funding the teaching. Nowadays, and Germany was a long defendant, and Sweden is even carving in, on free education for everybody. This is a myth. There's no free education. It's very expensive. And either you get it from your dean, or you get it from scholarships. And scholarships is, from my understanding, the better way that is also more performance-based. People come to you because they have selected you, because you have a good program. And this money, this will be teaching and research, but mostly, of course, research. This should grow. I mean, you should build it up. It doesn't come here. It will come like this. So that in the end, you continue at either same operation or slightly less, but at some stage you have to make sure that this is phased out in your budget. I would suggest you not to go with a budget every year it's 10 million, 10 million, 10 million, 10 million, but it should do 10 million, 10 million, 10 million, 7, 5, 3, 2. So you show the donor that this is, we are aware that we have to wean ourselves of this large red area here, which is so tempting to take as fuel, burn the fuel, and then close shop afterwards. But we don't want this, and the funder doesn't want this, and your universities don't want this. They want this to stay. So you have to have a strategy how to build this up. And from when on, maybe it starts a little bit earlier, and maybe it's a little bit less steep, and maybe it reaches not the same height as here, which I think it wouldn't. But you should somehow have a strategy how this is done, because this is money, this axis. Okay, I think I'm basically through core versus competitively acquired funds, and then map the disciplinary resources. I already mentioned this. Let me have a look. That was an important point as well. Thank you for, we discussed this in the break. I understand that there are many lab persons not only in the room but also interested in this. I acknowledge that lab sciences and molecular sciences have a role in public health and also in global health, but you should not overdo it. It becomes not credible if a lot of genomics and proteomics and so forth is in this proposal, unless it is justified by a research idea. So to build up biomedical facilities or basic science, biology, cell biology, molecular biology, facilities based on that proposal on global health will misfire, because it's not covered by the research concept. So, but I see a way out, or a solution to the understandable desire of yours to build, can I have the other slides now? To build lab capacity is on what Agus told us yesterday. In the overall SWAP program, there are, of course, it says lab equipment. And if we get the slide, we have found the slide, and we want to show it. First of all, leave it, please. These are the 8 centers, as you know. One comment that I had was also, how do you link to these 8 centers? Will there be a steering committee for all the 8 centers? A debt swap steering committee? It becomes very complicated now. You want to have a debt swap? I don't know whether you want to have, but it's a question. Because otherwise I don't see how these 8 centers, we have to ask Agus this question, how they're working together, or are they supposed to work together? Or are they just different centers that are evaluated specifically and individually, but there's no evaluation of the entire debt swap program? So I think that's a very important question we should ask Agus when he comes back to Saturday. Is there the expectation that, for example, food security cooperates with global public health, which would be a good idea? But then you would have to think how this works. And in which proposal will this be? Not in ours. Or do we say in our proposal, and by the way, the whole debt swap, 8 centers, they will work together through this and that and this will be specified in the overall debt swap proposal, which will then include the 8 centers. So that was a remark in general that I wasn't clear how the 8 centers are supposed to work together. But coming back to this lab agenda, so there are many centers, and here is the debt swap 2 overall program, and you see in the first years, this is Tahunke. I thought this was the centers, but I'm told this means years. So that happens when you don't understand the language. But I was put back on the right path. So in the first years, you have 10 labs to be funded, and we should ask Agus, how does this work? Does each of the 8 centers get 1 lab? Or so I think here is the way where you can introduce your requests for improving the lab infrastructure. But please don't overburden the global health proposal, because then they will say, oh, it's just a Trojan horse. They put a global health front, and then they come with their their artillery of proteomics, genomics, and so forth. So these were my comments, and I hope you take them as a base for discussion. Of course, who am I to impose something or to even suggest something? You know how to whether this is relevant and how to react to this if it's relevant. Thank you very much. It was a pleasure.
Thank you very much, Professor Sauerborn, for those insightful comments and putting things to perspective. So we'll have a few minutes just to, can you stay? Yeah. Later on, we'll have some discussions with our panels on what are the follow-up actions, but I would like to spend some time, to give some time for the audience to perhaps to react or comments on what Professor Sauerborn has just presented, if there are any clarifications or comments to what has been said. Anyone? Professor Rika.
Yeah, thank you very much, Professor Rainier, for the comments. And one important point that we agree very, very much, and I think it have been already there, but maybe not yet emphasized very clearly about coherence. So I think I'm agree with the idea and the proposal to be how we make it coherence in master and PhD joint program, because interlink between each other is very much related each other. So for joint MSc PhD related to SEAMOLEC objectives, that we want to have what we call it open distance learning, and we also want to, our institution want to have what we call it internationalization program of our postgraduate through credit transfer system, will be very much what do you call it appropriate to the point that you just mentioned. And also the pre-publication series is very important to develop the competence in writing a good publication. I think it's very good. But for my question is about demographic study for rural and urban, because we have to choose certain area for studies. And in fact, there are many institutions involved in this scheme. So how do you think that we can choose certain demographic areas in this study? This is my first question. And the second one is about the lab facilities. Since yesterday, the discussions about synergy between institutions, meaning that we will identify the need to support all of the research need in this NCD and might be climate change, and we don't want to complete all of the facilities in every institution, but we just put certain facilities and we share the facilities, lab facilities available in every institution. So exposure in idea, exposure in technology, and coherence. And at the end, we will have a multidisciplinary and exposed to capability of research will be built between institutions. So this is the idea of the lab facilities. We don't want to have whole series, but just put in certain area accordingly, and we will synergy and sharing facilities. Yeah, this is my comment, and I want to have your information about demographic, choose specific demographic for the studies.
Yeah, thank you very much. This is clarifying the point with the lab facilities, and I'm very pleased to hear that you will do some mapping, who does what, who has a good lab here and there, and then you will focus on those areas that are required to be strengthened by the substance of what we are proposing, and putting it there where it's already good, so synergies, and not everywhere. You're right. Thank you very much for clarifying this to me. And the choice of the demographic area, well, ideally it would be a representative section of the population. So some countries, or very few countries I must say, have gone through a random sample or stratified sampling. They say urban, we take 50% urban because we have 50% of urban population and 50% rural. And then you can have clusters, so you don't have to go to every individual household, but it's very costly, particularly in your country where you have 80,000 islands. This may be not feasible. So you have to come up with a roster of criteria which are important for NCDs and for climate change. And I think this should be a meeting of some experts. My first gut reaction to this would be you have an urban and a rural side. I mean, urbanization, we've seen that the entire population increase will be in urban centers, so you don't miss out the urban part. If you want to go for risk factors, of course, it will be an aging population anywhere. And this you will observe the aging process, and then many more of these NCDs come up. I don't know if you have any population subgroups, if life in Kalimantan is very different from life in Java or in Celebes. This is for you to determine. People and reviewers of papers, when you publish this, will ask you, is this typical? Does it cover the experience of the population in a reasonable way? Nobody will really ask you, oh, where's the statistical formula? Is this sampled from the population? That I think would be unrealistic. But if you, for example, if you only take a mountain area and you have only 2% of your population living in mountain areas, that's not a good idea. If you only take an inland area and 90% of the population live on coastal lines, that's not a good idea. So some criteria of this, that you have a reasonably good representation of the population. I wouldn't go too much according to the topics that we have. Of course, this would be my wish as a climate person, to have a coastal area for the coastal impact, to have a mountain area because malaria is creeping up there and so forth. But these should be really multi-purpose public health laboratories, I would call them, although sometimes people people shudder when they hear laboratory and population, but it's like an observation and observation and intervention evaluation area. So it is linked to, and for the students, you can't believe how easy it is once you have these data for students to do research there. They don't have to set up their own infrastructure. It's all there. They have data entry. They have everything. So it is also a means to facilitate research. And I wouldn't only do it for NCDs. I wouldn't only do it for climate change. I wouldn't only do it for the two. I would leave it open and say this is an investment in our global health research agenda. If somebody comes later with another project and he wants to do mental health, welcome. If somebody wants to do infectious diseases, dengue, welcome. And if somebody wants to do metabolic diseases, welcome. So I wouldn't specialize it too much according to our specific research agenda, but let it be broadly typical for your population, so that what you are finding, what we are finding, is then you can tell the minister and you can then tell the academic community in the world, we did this in a population in 2 sites and we compared, which capture largely the typical population in Indonesia. And if some reviewer says, but you didn't ask people on the mountain, then you say, well, welcome to this world. If you give me the money to do it everywhere, we can do it. But this is not a relevant point. So these are some ideas on your first question. Can I just, I forgot one point in my comments, which I didn't manage to type in the PowerPoint. I think what you need now for the next 4 weeks is a very high discipline and high power and well-structured and well-led operation of proposal writing, and this needs a leader. It needs a secretariat, maybe some students who help in searching something, and a work plan. A detailed work plan, who does what, by when the MOU is signed, by when Agus has explained how this links to the 8 centers and so forth. Otherwise, it will be very difficult. 4 weeks is very little time for all the tasks ahead, and I think you need a fresh, focused person. Well, I would think it can't be a student. It must be somebody who knows how to write proposals. It doesn't have to be a guru. Can be a mid-career person. I'm not looking at anybody now. But I mean, somebody like Yodi, I think it would be a very nice person to do that. And the other thing was regionalization, internationalization. Maybe this has to be developed in the proposal. Agus, if you hear Agus, it's all Simulec, it's all regional, but it is not clear to me how you get from your center to a regional focus. Will you become a regional center of excellence? Will you want to have students, I hope you do, students from the region? How will our center become important for the region and irradiate into the region? That is not clear to me. The purpose and the goal is nice to say, but the steps, again, there are some rungs missing in the ladder. You want to climb up to this window and you put a ladder, but there's only one bottom rung and one top rung, and you don't know how to get there. So the steps, how will you internationalize your teaching, your research? Somebody mentioned, I think you mentioned TropEd. Yes, we are partners, Heidelberg, and we are partners in this. Would be an option, but then you kind of, if you only want to do it with TropEd, you kind of submit to their ideas, their master curriculum, and you can add modules, advanced modules. But I would be bolder. I would offer a complete master program. Maybe in the beginning you can start with short courses, which you can accredit in TropEd, but then I would go for a complete master and of your design. because Drop Ed requires you to take their design, which is good, but it's not maybe not the best that you can do as the center. And the last thing is ICT. There is one of the aid is information and communication technology. Not only do we need it for talking to each other, but also for doing the research. For example, mobile phones. I just come from Dhaka, Bangladesh. They have a wonderful program of using mobile phones for diabetes control. All this long-term adherence that you need for NCDs, how are you going to adherence of patients to some prescription or some blood pressure control? This is, you should make a big splash, I think, in the proposal about we will innovate the control of NCDs by using state-of-the-art ICT in an innovative way at the population level, so that the newly discovered diabetic patient gets as a first thing not a prescription but a cell phone in his hands or her hands with an application where they can ask for help, where they can put their blood pressure. They have a blood pressure machine and it goes by Bluetooth to the cell phone, and the cell phone sends it to the diabetes control center. So we need somehow to say what the direction of our innovation in NCD control is, and one I think would be using state-of-the-art, particularly mobile communication technology. And in the climate it is less, well, you could also use mobile phones for early warning system, for example. In China they have a big projects where they give to village people their own their cell phones, and they must report, or the village health worker, if there is let's say they have a suspect of dengue, or they have a new disease, or they have whatever they register. So using ICT and linking up to theme number center number 2 or 3 would be very, very appropriate, I think, in this area. And the last one, sorry, that was somehow forgotten in our presentation was leadership, training for leadership. Since we will recruit a lot of young people, they will be, of course, bright, committed, everything, but they need the key competences, and it's not only how to write a proposal, but it's also how to recruit people, how to manage a group, how to be a leader. They will, and Yuri knows this, they will be leaders of international research consortia. How do you do this? How do you resolve conflict? How do you inspire people, and how do you make sure that every person is heard and every person's agenda is taken on board? That is an art that, for example, Professor Yati, she made a strong point about this, and since she's not here, I wanted to convey this, the leadership issue. I think that's all I have to say, and I took already a lot of time.
Okay, thank you. Any other comments or clarification for Professor Sauerborn before we move on to the next subject? No? Okay, thank you very much. Let's have an applause again for Professor Sauerborn. Thank you. Okay, so you have something for Professor Sauerborn. Okay, please, it's okay.
Maybe others also have things to say. You mentioned about that we need to be very firm about the content of the proposal. And my understanding is that the proposal that we are writing is not a research proposal, right? So it's not a research proposal. It's much at a later stage, that once this is set up for the activities of the consortium, then we can build research proposal, and the consortium should be able to facilitate a workshop to be able to produce excellent proposal. So I'm trying to understand, because at the moment I think what needs to be done within the proposal is that all of us should be convinced that what we put in the proposal is really in line with the theme, with the global health theme. There may be other parts that doesn't seem to be directly directly related to global health, but then we could develop and include and integrate further once we develop research proposal. Am I right, Pa? So because related to the biomedical engineering, I was thinking of maybe we can put a proposal on molecular epidemiology, which is now is also very more than, I mean, when we develop the research proposal, then we could have sort of perhaps more flexibility to integrate all aspects that can be related to NCD, can be related to cancer, diabetic, whatever, including, for example, the molecular biology, or in the proposal we have, for example, herbal medicine, which maybe for external reviewers would not see herbal medicine as a global health issue, but still later on we can sort of try to produce research proposal that has that component. For example, we could do research on diabetic mellitus and then see what kind of herbs that the people use before they get into the medical treatment, for example. Then in a way that we could incorporate also the other interests within the group. So I'm just asking, is this am I?
Well, I don't know what's right and wrong. I only know my take on this, and I think it's very appropriate what you say. We should avoid listing a too detailed research agenda, but we should have a research concept. I mean, we can't say we build capacity on anything under the sun, but we are going to say, here's our concept, and we have it already largely in the proposal. Maybe it can be strengthened based on Yodi's presentation, but we should say, here's our concept, and here's what we want to achieve, and in the first 3 years, we will develop specific proposals that translate our concept into research activities. And please evaluate it at your year 4, then you can do a scientific evaluation. For the moment, and a capacity building. For the moment, we can only have a concept, these two clusters, how they are linked, and then it's more of a process, how we build capacity, how we tackle these big ideas. And and so junior groups, doctoral students, hiring of this and that, setting up the DSS and master course, and what you have it. These are activities that are in itself unspecific, if you like. They are only related to the project, but you don't have to say sample size and this is for the next phase. And then in the next phase, maybe we should phase our proposal and say after year 3 we will have then selected, and we will see the 15 research proposals that have been submitted, and then we will be evaluable on these lines. So I think that's very important that you say this is not a research proposal, it's a research concept for a large program to build up capacity on in these new areas. So just justify why this is important, why you have chosen this, and then how you build up the first 3 years, and that after that we can talk about specific. And I wouldn't mention herbal medicine, I wouldn't mention topics too much. I would just mention disciplines. That you say this concept needs global health, like public health, needs labs, needs molecular. Harvard has 2 chairs in molecular public health. So I'm aware that this can contribute a lot. It needs it needs clinical knowledge. How do you do diabetes control if you don't have a clue how the disease is treated? It needs social sciences, and here you're a little bit under represented. It needs geography, it needs mathematic modeling, it needs what have you. And if you can do the mapping already now, saying here are the discipline we need, and this university has 3 points, this has 2 points, and we want to have this university as a leader in cultural studies. I think Madhya Gada is such a leader, and another one does more this and that. That's very fine, but that doesn't specify any topic like herbal medicine or clinical research or this. just what you need and where you have it and where you want to improve the capacity. And then in the next phase, if somebody of the junior groups comes up with a great idea to use herbal medicine, by the way, for diabetes control, there are some candidates. I know of a project between Taiwan and Tanzania that use sour cucumbers. I don't know. It's a plant and it reduces blood sugar levels, and they are testing it whether it can be extracted, the active principle. So it could well be, but I wouldn't mention it now. I would mention it only after 3 years. That's my take on this.
I think what Professor Aditari mentioned is very important, and we actually already put in the in one of the slides that if we agree the concept is, you also mentioned about translate the research into policy. So we put the translational research from community or from clinic to the bench or to the and for analysis, and then given back to the clinician or clinic or community to advocacy, to clinic decision making process, and then at the end will be proposed as a national policy, and maybe will go to health system. So it means that many disciplines can join in this activity, from biology, from geography, from social, from science. I think it will be very open. Yeah.
To be considered good in and of themselves, but nobody knows really how to do it. Interdisciplinarity, how are you going to promote interdisciplinarity? One way would be to have a doctoral committee, if you have committees at all, I don't know, or if you have just one supervisor, that have at least 2 disciplines. So that is a safeguard against one discipline getting carried away with itself. An anthropologist who only does studies rituals, the healing of cancer, or something. But if you have then an epidemiologist next to him or her, that might be a good idea. And there are other ways to stimulate this. But just since it's so important for global health to link all the disciplines that you say, and link it to, in the end, to policy making. That is also one tenet of global health. Then you must also show how you are going to do this. And there are, again, this is one thing that I said, to have interdisciplinary working groups, or to have an interdisciplinary seminar series. These are kind of, and you need to understand the concepts of the other disciplines. Maybe that should also be put in the, if for example, an anthropologist never publishes a paper, well, rarely, they write books, or they do films. And a molecular biologist, he wants to publish in New England Journal of Medicine, and he knows impact factors. An economist is not interested in impact factors. He is interested in his econometric models. So every discipline has their own terminology, their own evaluation criteria, scientific products, and it is very easy to fragment, to get into fragments. Everybody does this. So there needs to be some, like the ethics, there needs to be some kind of interdisciplinary, you would call it epistemology of research. Now, what is research? Is it lab research? Why is lab research superior to social cultural research? No, it is not. It's just different. And then people learn the criteria and the concepts. What is a model in anthropology is not a model in mathematics. So it can be very confusing. And if you produce some ideas how you foster or enforce, like in a doctoral committee, interdisciplinarity, that would be a good approach to this. Okay.
Any other remaining comments, clarifications? Yeah, Alpan. Yeah.
Points that just mentioned by Professor Renier about the committee of doctorate committee. Sometimes we also face proposals that are very limitless border between clinics, between basic and also public health or social. So in this regards, we will, of course, we will invite experts in their area. So there will be no problem for the in terms of contents as well as for the supervision. Yeah. 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 Okay.